Well, a year on, over 1.5 million of us have had COVID-19. Over 52,000 people have died in South Africa. We've had multiple periods of lockdowns with varying severity. We're facing a third wave and concerns about super spreader events over Easter and possible new lockdowns over Easter as well. And of course, while that initial 21-day lockdown, one of the strictest in the world, may have delayed the virus's spread, it certainly did not stop it. And we're dealing with the consequences that we did not anticipate fully as well. Let's talk now to Mark Heywood, veteran health activist and editor of Maverick Citizen. So, Mark, 1 year on from that announcement by the president, that looming lockdown will kick in a couple of days later, what were you feeling this time a year ago?
Good afternoon, Sally. I think I was probably feeling what most other people in our country were feeling, which was anxiety, a certain amount of fear and trepidation about an unknown, completely unknown to all of us, and obviously hope that this was the right thing to do to try to contain the spread of COVID-19, which, if you recall, at that time we knew a lot less about. It was a much smaller, even global pandemic. I don't know if it had been declared a pandemic by then. But I was also thinking about how we as a country would manage, and hoping that we would do the right thing, both to prevent COVID-19, but also to do so in a way that respected people's rights and dignity in terms of our Constitution.
Yeah, I think there have been so many unexpected consequences. I want to play another clip from the President's address from the 23rd of March last year. Take a listen.
Our analysis of the progress of the epidemic informs us that we need to urgently and dramatically escalate our response. The next few days are crucial. Without decisive action, the number of people infected will rapidly increase from a few hundred to tens of thousands, and within a few weeks to hundreds of thousands. This is extremely dangerous for a population like ours, which has a large number of people with suppressed immunity because of HIV and TB, and high levels of poverty and malnutrition.
It's so interesting. We were so worried a year ago about people with TB and HIV that they would get really, really sick if they contracted COVID-19. Turned out not to be the case. More the issue around poverty was exacerbated. But there are different consequences, and I'm asking you this, of course, because it's World TB Day. We have seen that TB and HIV testing and treatment have taken a massive knock in this COVID year, haven't they?
Yes, they have. I mean, TB testing has declined, I think, by about 50%. And on this World TB Day, you have to remember that TB still killed more people in 2019, or caused the deaths of more people in 2019, than the total number of deaths of people from COVID-19 in the last year. In 2019, it was 58,000 people who were recorded to have died because of TB. And it was the same the year before, and the year before, and the year before that, which is why we have to use this World TB Day to once again decide to take TB seriously. I mean, I know that the Treatment Action Campaign today has marched in Mpumalanga, has handed a memorandum to the Deputy President calling upon TB to be declared a public health emergency. And I think that's right, because every TB infection is preventable, and every TB infection is curable and has been curable for decades. So the reason we still have a TB problem in our country is because of failure of our health system, failure of our health services, and in many ways a lack of political will to deal with the TB pandemic, because TB has always been a poor person's disease, and people with TB very often die out of sight and out of mind. So I think we must take the same standards that we have correctly applied to COVID-19, the same sense of urgency that we have applied to COVID-19, and apply it to other causes of death and disease that face our country.
You know, you spoke about a poor person's disease, or that's how it's perceived anyway, but certainly with COVID-19, the economic impact is likely going to last longer than COVID-19, well, certainly if we get vaccines anytime soon. As we go into our second year of COVID-19, can we afford to not have a basic income grant for all poor people in this country?
No, I don't think we can. I mean, we've talked about a basic income grant for a very long time as a country. Government has tantalizingly held it out to people as a possibility, but we haven't implemented. Now, what we know COVID-19 has done is it has dramatically increased the numbers of people who are unemployed by at least 1.5 million people. We know, Sally, that at the end of April, the COVID Special Relief of Distress Grant will be ended. And we know that there are really tens of millions of people who have no means of subsistence at the moment other than through some sort of system of grants. So I think, you know, COVID-19 is requiring us to rethink many aspects of our society. And one of these is the need to introduce a basic income grant. But it goes much further than that. I think we need to be exploring new economies, new areas where we can create jobs, new means to reduce the inequalities that have been deepened by COVID-19. So, you know, even if we are successful with a vaccine rollout, and of course there's many question marks over that, even if we bring COVID-19 under control in the next 12 or 18 months, the emergency that has been created by COVID-19 will not have gone away and will continue to challenge us for a very, very long time. And we have to be thinking now about what we do to fix that.
Thank you so much. Veteran health activist and editor of Maverick Citizen, Mark Heywood, thank you so much for joining us.